So this was the HERIZON BTC-01 trial. This was for locally advanced, unresectable, or metastatic HER2 amplified BTC. Majority of the patients were metastatic HER2 amplified BTC. They had to have received prior gemcitabine containing regimen. So you could have one prior regimen or more than one prior regimen. And this trial was a global trial conducted across 32 sites, 4 continents. And in this, Zanidatamab was given as a single agent. So it was given IV once every 2 weeks. So we did, scans after 2 months. We looked at primary endpoint was overall response rate. And then we looked at, progression-free survival, overall survival as secondary endpoints. So about 80 patients were included in our HER2 positive cohort. And the patients were either HER2 3+, which was the majority, and a small minority were HER2 2+ by IHC, and all patients were ISH positive. That means in situ hybridization positive. So that's how we said they were HER2 positive. That's what the data we presented and published. Yeah, so it's something called a biparatropic bispecific antibody. So it binds to 2 domains on HER2 called extracellular domain 2 and 4, and kind of that's it kind of internalizes the HER2 protein, and it leads to its mechanism of action. That's the main one. And Zanidatamab, in the phase 1, there was a basket phase 1 trial was tried on multiple different cancers. Biliary tract cancer was one of them. Breast cancer was one of them. Upper GI cancers were one of them. But when we're looking at the development of it, at least currently with the studies which are phase 2 and 3 furthest along, are the studies with upper GI cancer, so HER2 amplified upper GI cancers, and then obviously the biliary tract cancer. And it got approval in patients with biliary tract cancers, HER2 amplified biliary tract cancers, specifically IHC 3+ patients. Yeah, great question. So in the monotherapy is the trial that we did after frontline. So in that, our primary endpoint was overall response rate, and we got a response rate of about 41.3%. So to give you context, in unselected patients, if you use, let's say, FOLFOX, which was on a trial, the response rate was 5%. So there was definitely improvement in response rate, but this was a single arm trial, really was not randomized because of the rarity of the cancer. So, and then the interesting thing was the patients who got a response, the 41.3%, had the duration of response in them was about 14.9 months. So they had an improved duration of response. So that was, that was very interesting in these patients. The other thing was that when we looked at the median overall survival, and remember these are pre-treated patients, refractory, the median overall survival was about 15.5 months. So that was interesting. So because of these, results, got kind of the approval, but now we have launched a phase 3 trial, which is a global trial in the frontline setting, in which we are giving standard of care, which is normally gemcitabine, cisplatin, with a checkpoint inhibitor, either durvalumab or pembrolizumab. And in these patients, we are adding Zanidatamab or not. So plus minus Zanidatamab. It's a randomized trial. We started it, about a few months back. And the trials in progress poster is going to be presented at ASCO. Yeah. So the side effects, in the beginning, a few patients had infusion-related reactions, but now we pre-medicate the patients. So that really took it down to very small number, single digits. Really was very well tolerated. No deaths from the Zanidatamab on the trial. The main side effect that we saw was diarrhea, which was well controlled. So patients did get diarrhea, but if you gave them over-the-counter Imodium or something, it was controlled. So next steps is obviously, we have the kind of approval based on single arm after the frontline setting, but the confirmatory study is being done in the frontline setting. So we, hope for a robust accrual to that trial, so we can hopefully, that can lead to its, approval in the frontline setting. But obviously that trial, we'll see what the trial readout says once it's accrued.